The enormous strain of India's coronavirus lockdown. Millions of migrant workers are struggling to return home. And self-isolation isn't an option for many. So, what can be done to lessen the impact? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. It's been a week since India began the world's biggest lockdown to stop the spread of coronavirus. 1.3 billion people have been ordered to stay home. India has around 1,600 infections so far, but with one of the lowest testing rates in the world, scientists fear the number could be much higher. Health workers are trying to track down around 2,000 people who stayed at the headquarters of a Muslim group in New Delhi. 128 people who attended a religious gathering there 2 weeks ago have since tested positive. 7 have died. Organizers denied breaking social distancing rules, saying they were forced to accommodate visitors after Prime Minister Narendra Modi announced some measures with just 4 hours' notice. Delhi's chief minister has urged police to file a negligence case.
In the current situation, it was completely wrong to have held such a big gathering. We're being told that many who participated in the gathering have now traveled to other parts of the country. It's scary to even think about how many people have come in contact with the disease because of this.
The lockdown has stranded millions of migrant workers trying to return to their home villages. Many risked infection by cramming onto crowded trains and buses before transport services stopped last week. Others have been walking hundreds of kilometers to reach their homes.
We're walking because we didn't know what was going to happen or if there would be any transport available during this chaotic pandemic. My landlord said he would not give us any money or food and asked us to vacate his room and leave.
We lost 2 months' worth of labour work and our landlord told us to leave. He stopped giving us any money or food from March 22nd.
Social distancing has been hard to enforce in the world's second most populous country. Hundreds of millions of people live in cramped spaces with poor access to water and sanitation. Officials are also worried about the spread of misinformation. Police say they will prosecute anyone spreading rumors about the outbreak on social media and messaging apps. All right, let's bring in our panel. Joining us from New Delhi, Barkha Dutt, a television journalist and newspaper columnist. Also in New Delhi, Chandra, Bhushan, the CEO of the International Forum for Environment, Sustainability and Technology. And in Goa, Meenakshi Ganguly, South Asia Director at Human Rights Watch. Welcome to you all. Meenakshi, let me start with you. Human Rights Watch says the lockdown has already disproportionately hurt marginalized communities due to the loss of livelihood and lack of food, shelter, health, and other basic needs. And they've urged authorities to adopt measures to protect the most vulnerable. So my question is, what measures need to be taken?
A number of measures need to be taken almost immediately. The first thing that happened was because this lockdown was announced so abruptly, the supply chains are not quite working, which means that people who rely on subsidized food services from the state no longer have access because the shops are closed, and even if the shops do open, they do not have supplies. Daily wage workers need wages because that's what they rely on for their food. The Rural Employment Health Scheme needs to kick in very quickly to expand its space because a lot of people are going back because they no longer have jobs, their factories are closed, so they're back to their communities. So the basic social network, the security services that the public services that need to be provided need to be strengthened and deployed almost immediately.
Barkha, how much do religious and sociological factors in India complicate the response to COVID-19?
Well, I think the biggest complicator more than religion or culture is poverty. Like in any country which has hierarchical societies and perhaps not a fully formed public health response system, we are seeing the poorest of our poor actually taking the hit for, as Meenakshi said, this very abruptly announced lockdown. Do remember that India spends less than 2% of its GDP on health, We have 45 million migrant workers, and we have more than 90 million households that live in one-room homes. I'm only driving that last statistic because social distancing is sometimes a luxury that not everybody can afford. And when you have 5 people, 6 people living in one room, what does it even mean to tell them to stay at home? The second dimension to this is that because so many of these people are transient workers, in other words, they live somewhere else and they work somewhere else, you have small and medium industries virtually sacking them on the spot, which is why we saw this mass exodus, this mass movement of hundreds of thousands of our poorest walking sometimes hundreds of kilometers on foot. I reported on many of these stories myself. I met a lot of these people. I've seen children as young as 5 and 8 walking hundreds of kilometers. So I think what we're really seeing here is many people saying the poverty will kill us before coronavirus will.
Chandra, you've written that environmental destruction is one of the underlying causes of this pandemic. How does that affect what is currently going on in India?
Well, I think there are multiple reasons why we are seeing zoonotic diseases coming time and time again. And environmental destruction obviously is one of the factors. Ecological destruction is bringing animals and humans together, which is leading to jumping of microbes from animals to humans. And that's what we have seen in the past zoonotic diseases, whether you look at swine flu, which happened from pig farm in Mexico, to SARS in 2003, which happened from China, again, a wet market in China, and COVID-19, most probably, 99% it is a zoonotic disease coming out of wet market in China. So one, environmental destruction is a factor, but also there is a cultural factor that is quite prevalent. It is not specific to China, but the culture of eating exotic meat and sometimes raw and not regulating it well is the third factor. And the fourth factor is intensive animal farming, which we saw in case of swine flu. So there are multiple factors which is increasing the intensity and frequency of zoonotic diseases. As I said, this century this is the third pandemic that we have seen in 20 years, which is very rare in last 200 years. If you see the history of pandemics, this is probably the highest number of pandemic in last 2 decades that you can trace in past 2 centuries.
Meenakshi, how much has the lockdown been hurting marginalized communities in India?
I think that we have to start looking at the challenges that a country of India's size faces. It's over 1 billion people. Trying to contain 1 billion people and spread this virus is a huge challenge. And this is really important because if the virus spreads into the countryside, the public health services are so poor that we will be facing a disaster. Now, in that, if the government decided that they must have a lockdown, the point is that there should have been better planning. Now, when you have to administer that many number of people, that planning has to be something where systems are put in place, not in the 4 hours that was given between the time the Prime Minister announced the lockdown and midnight when the lockdown kicked in. And therefore, what has happened is that none of the instructions that should have gone down went down properly. Forget the supply chains. In terms of rights, the fact that, as Barkha was reporting earlier, the fact that all these people were being beaten up on the streets. Now, where are they supposed to go? What is the food security that was put into place? But what was the shelter that was put into place? These are not to undermine the challenges that the state faced, but this could have been planned a lot better, and it hasn't been.
Barkha, there's been a lot of outrage due to a video that has circulated online showing Indian health workers spraying a group of migrants with disinfectant. What does that say about the state of affairs in India that this is going on right now?
Well, I just want to separate the strands of the debate here. There is the lockdown and the idea of the lockdown that I think this country widely accepted as inevitable and necessary. I think we're seeing different stages of lockdown across the world. And I think that where we are critiquing it is the planning and the amount of time. And if anything, I would argue that this lockdown needed to have been planned much earlier. We needed to shut our borders much earlier, and we needed to give ourselves more time so that we could plan this properly. To the video that you speak about, that video to me personally was extremely disturbing because it was basically these migrant workers who had returned home, possibly on foot after walking hundreds of kilometers, and a fumigation spray that was meant to clean buses was used on these workers as they sat on literally squatted on the road. Now, there has been pushback from several commentators who say that fumigation sprays or disinfectant sprays are routinely used in other countries as well. But the choice of the fumigation was a chemical that's meant to clean buses. And then there was the basic denial of dignity to see all these poor men literally be herded together like as if they were mosquitoes. The local administration accepted this to be a mistake. To be clear, this is one district in India. This is not something that's happening rampantly, but I think it's important to also underline that for all of these incidents, there's also many of us who do make a noise, and there is pushback, and then there are corrective measures that are taken. But I think you have to understand the gigantic scale of what we're dealing with here. You see the Americans struggling, and if you compare our population numbers, we're the world's most populous democracy, and we're also a democracy. So that also makes it, in a sense, tougher to contain these 1.3 billion people and just tell everybody, hunker down and don't move.
Chandra, there's been a lot of confusion about the rollout of the lockdown. From your vantage point, is the way the lockdown being implemented going to be sufficient to try to combat the spread of COVID-19?
So I think, on the hindsight, I have heard other two panelists speak about the problem that the marginalized community and the poor are facing. I also agree that we could have planned in better. But if you look at, it's amazing, in the last 1 month, we have had close to 100 modeling studies that have come out, looking at different scenarios and predicting how government should react. I think when the cases were less than 1,000 and we have announced lockdown, it is the right step. I believe that across the world, whoever has done lockdown quicker has seen flattening of the curve much quicker. Will that happen in India? We will have to wait and watch, but my sense is we will certainly flatten the curve. Without lockdown, we would have had a lot of problems. If you see the modeling study, they also say that in any pandemic, you look at pandemic, SARS was probably for about 6 months. We were able to contain it in 6 months, largely because the nature of virus was very different. It wasn't as infectious as we are seeing in case of this coronavirus. But if you look at Spanish flu that happened in 1918, it went for 2 years. In India, we had 2 spikes of Spanish flu in the beginning of the year as well as in the end of the year. And a lot of modeling studies are saying that you might require multiple lockdown because suppression strategy does not ensure that you will be able to control this virus in one lockdown. So I think we need to be mentally prepared for a long haul. The very idea that one lockdown is going to be sufficient in terms of suppressing this virus, I don't think that is going to happen, not in India, not in US, not in any part of the world. In fact, China is already preparing to see the next round of the increase in numbers that they're expecting.
Meenakshi, I saw you nodding along to some of what Chandra was saying, so I want to see if you have a reaction. But also I want to ask you specifically about the fact that Human Rights Watch is also reporting that in some parts of India, health workers have faced discrimination from their neighbors and that landlords have in some cases attempted to evict them. So do you think that stigmatization will increase against doctors and nurses and other medics and healthcare workers?
Well, often we are told that a disaster is not the best time to promote human rights. In my view, that is actually the time when our values are tested most, and it is the best time to promote human rights. So at this point of time, the bigotry that we are seeing, the number of people, for instance, even in the US, Asian Americans are facing sort of bigoted treatment. In India, we've seen people from the Northeast being targeted. Now, India also has in the past had problems where there has been a tendency of vigilante violence, of stigmatization, and therefore it is very important right now that, as Chandra said, that this is going to be a long haul. it has to be a rights respecting process, which means that the instructions have to come from the top. That means that police have to be told that they are not, when they are enforcing this, this is not a police state. They're enforcing a lockdown for people's protections. It means that people, very importantly, that people are not behaving in a way where they're punishing their neighbors, or we have had reports of airline crew being ill-treated by their neighbors because they were flying in people from outside, Indian citizens stranded across. Now, this kind of behavior, it's ill-informed, it's wrong, and there has to be very strong messaging at this point of time to make sure that India comes through this as a rights-respecting state and a rights-respecting people. And this is really, I keep urging, because the Indian Prime Minister has enormous clout. When he summoned people to come out at 5 p.m. and celebrate health workers, people came out in droves. This is a man who can command that kind of respect. That same command now needs to be messaged right, to ensure people survive this. People are careful and adopt all the precautions that they need to do, and they also have to be extremely rights respecting in the way they treat their friends and neighbors.
Barkha, it looked to me like you wanted to jump in and add to what Meenakshi was saying, so please go ahead.
No, I was just going to say that we've seen this stigmatization against pilots, as Meenakshi mentioned, but even against doctors. Doctors and nurses and health workers are being discriminated against. We've had reports. I've personally interviewed people who've been evicted from their homes. And look no further. My small team of colleagues and journalists, including myself, have come under pressure from neighbors. I had an argument today in the neighborhood with people who asked me why I'm going out to report. And it's very difficult to explain to people that this is an essential duty for journalists and many other people, doctors and health workers obviously being key and in front of the line on that one. But you literally find yourselves arguing with people and needing to explain to them that some of us need to be out there to do our job. So I think bigotry and stigmatization is a major issue, and it's not unique to India. We're seeing this kind of the underbelly of societies play out, of inequality, of prejudice, because people are scared, they're panicked, and they're lashing out in whatever way that they can, and it doesn't make it right. And there has to be institutional protection against all of this, because otherwise people who are in essential services cannot do their jobs.
Chandra, let me ask you specifically about the problem of misinformation. Just how rampant is it right now? How much of a challenge is it in trying to effectively combat the coronavirus?
So let me break this question in two parts. I think the general message that people have got, and I think we need to modulate that message, is that it's all going to be over in 3 weeks if everyone is separate, if we strictly enforce it. And therefore, you are seeing a panic reaction of people when a person like Barkha goes out, they will feel as if she's violating some code of conduct. Okay. I think this message needs to be modulated. This is a virus which is infectious, but it is not so infectious that if someone comes out from outside, is going to infect everyone in a colony. So I think there has to be a much more modulated message on infectiousness of this disease. I think we have not done that. In fact, scientific community in India has not done that. That's one. Point number two is, we are at one place, I think we are very weak is in terms of providing testing facilities to people. One of the success of HIV was that if people, or for that matter, any disease, is that people have easy access to testing facilities. So if you're scared, if you're worried, if you feel you have got it, if you have any kind of psychological problem, you quickly go and get the test done. That is becoming a major problem in India. The current protocol that has been set in place to do the testing is extremely complicated. We have not got the quick testing kits that countries like Korea and others are using en masse. I think if those things, proper messaging, and I think testing is also a psychological tool that we need to recognize. It is not only about finding and isolating people. It has that role to play. A major role is that. But it is also for people who are really, really scared. They want to know whether they are safe or not. And easy testing will have to be made available to them as quickly as possible.
Meenakshi, India has launched a massive search to track down those who attended this event that was organized at a mosque in New Delhi. Dozens of people had tested positive for coronavirus, and now there are authorities that are accusing the group of ignoring the threat of COVID-19, and there are some who are calling on the authorities to file a criminal case. Many worry that this incident has the potential to stoke religious tension. What do you think?
Well, I'm afraid that is partly what I was alluding to earlier. Because India right now has been for some time now on a very angry edge, but largely driven by a political ideology, which has created communal divides, and it has created almost a distinct hatred for Muslims, which has been going on for a number of years now, and this kind of example where this thing happened, and the level of rhetoric that is coming out, not from politicians, it's coming also from television networks. And that's terrible. On social media, people have been called, this was a terrorist gathering. This kind of thing is terrible, because that's what I meant, that the leadership right now, just as much as scientists and political leaders need to inform people, give them the correct information so that there is not enough panic, there needs to be an end to hate. And this has to be, whether it is the health worker who comes back home, whether it is someone who has attended a religious function and is now showing infection. Because before this, there was another case of an actor who was tested positive, and then she went to a party, and then a criminal case was filed against her. You cannot criminalize disease. The thing is, these things are ill-informed, so therefore people's actions need to be more informed. That is the way to take precautions. But to start criminalizing and to start stigmatizing and to be bigoted is just not going to work, because this is something that everybody has to work towards to end, and not just in India. This is a global challenge. This, as I said earlier, is when the world is going to be tested on how they come through on this, and whether they are rights respecting or not, or whether they're going to be hate-filled and bigoted.
Barkha, what about vigilante violence? How much concern is there that we could see an increase in that type of violence in India?
Well, I think at the moment, everybody is far too scared and literally hunkering down. And I would worry ahead of vigilante violence or violence over food. There was a video that one of our reporters sent where you can actually see people in a small village running after a truck that's carrying food supplies for some other part. And remember, the food supply chain is vulnerable at this point. Now, I just want to underline again and again that I agree with Chandra, that I think the data tells you that countries that locked down earlier have succeeded, if not in flattening the curve, at least in delaying the peak of the virus spread, the contagion spread. So I do support the lockdown, but I do criticize the way the way it was planned or executed on the ground, and I do wish it had been much earlier, because I think the first confirmed COVID case in India was in January end. And I do think we kind of let the month of February and a little bit of March go by without doing essential things. I have a slight difference of opinion with Meenakshi on, obviously, I don't believe anyone should be stigmatized. I do believe that if you get the coronavirus infection, you're not a perpetrator, you're a victim. But we do see people jumping the self-isolation, jumping the quarantine, being irresponsible, being somewhat cavalier. And the point is that if you do that, you're not just endangering your own life, you are endangering the lives of possibly hundreds of thousands of others. And therefore, I'm a bit ambivalent on this idea that there should be no punishment. I do feel that if there is knowing, willful, almost self-indulgent sort of fibbing or not disclosing the fact that you've come from a country that is COVID hit, or you jump your quarantine, there should be consequences for that, because you are endangering other people's lives.
All right, well, we've run out of time, so we're going to have to leave it there. Thanks so much to all our guests, Barkha Dutt, Chandra Bhushan, and Meenakshi Ganguly. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.